Dear colleagues, thank you for this opportunity to talk to you about novelties in functional magnetic stimulation as a conservative treatment option for female urinary incontinence. My name is Ines Krištofić and I am a gynecologist with subspecialization in urogynecology from University Hospital Center Rijeka in Croatia. And thank you once again for this opportunity. Through life, we have different life goals. At the beginning of our lives, one of the biggest achievements is losing diapers, and our parents and families celebrate that achievement. As we grow older, we change life goals, but at the autumn of our days, again, life without diapers is achievement. And for some people, struggle to stay dry begins in their 20s and their 30s, and not in their 70s and 80s. So you can imagine how urinary incontinence disturbs their lives. As you all well know, urinary incontinence is unintentional accidental loss of urine. Stress incontinence is a type of involuntary loss of urine that happens during physical movement of activity, most common at coughing, sneezing, and laughing. Those are all activities that elevate abdominal pressure, that is stress, on the bladder. Stress incontinence is not related to psychological stress. The incidence of urinary incontinence is between 2 to 55%, depending on the definition, type, and sex of analyzed population. In persons accommodated in institutions for elderly, it is higher than 50%. If I would ask you to give me an estimation, what is the incidence of urinary incontinence in the group of young women from 16 to 30 years who did not give birth, I do not think that many of you would say 13%. It only shows how big is the number of women with this embarrassing condition. Stress urinary incontinence is the cause of 49% of urinary incontinence in women, urge incontinence in 22%, and mixed urinary incontinence in 29% of the women. Urgency urinary incontinence is a symptom defined as a complaint of involuntary loss of urine associated with urgency. Urgency is defined as a complaint of a sudden desire to pass urine which is difficult to defer. So person feels the need to void and cannot make it to come to the bathroom, but empties its bladder soon after a sensation to void. That is urgency incontinence. In some patients, urgency incontinence appears on very small amount of urine in the bladder, sometimes less than 80 to 100 milliliters. As said before, in urgency incontinent patients feel sudden intense urge to void, followed by an involuntary loss of urine. Urinary frequency is the need to urinate many times during the day, sometimes more than 30 times. Those patients urinate less than normal volumes of urine per urination. Nocturia is the need to get up at night to urinate, so the person wakes up from firm sleep just to void, and it happens in some patients more than 5 times during the night. The devastating fact is that 50 to 70% of women with urinary incontinence do not seek medical help and treatment, and in average they silently suffer for 6.5 years before seeking help. If you ask why is this so? Most healthcare providers do not routinely ask their patients about incontinence, and patients may be waiting for the healthcare provider to start the conversation. This condition is called the doorknob moment because patients are often too embarrassed about their symptoms and they don't think there are any available treatment options. Such patients wait to mention their concerns and questions about urinary symptoms until the last minute of the visit, then their hand is on the doorknob. And therefore, it is very important to remember, while it may appear to be an afterthought, it is likely that urinary symptoms have been causing this patient a great concern. Patients may have been suffering silently for years, but were afraid or embarrassed to discuss the problem with their healthcare professional. Diagnostic procedure is quite simple. By taking thorough anamnesis, in 60% of the patients we can determine the type of urinary incontinence. Combined with a 3-day voiding diary, where patient can write all data regarding fluid intake, type of fluid, that is coffee, tea, water, number of urination and quantity of urination. That data collected in voiding diary is a great addition to gynecological and urological examination. In this slide, I have presented simplified evaluation of women with urinary incontinence. At first, we have to determine the type of urinary incontinence. First step of every treatment is change in lifestyle. That is lowering of the amount of coffee and carbonated drinks, such as colas and other soft beverages. Reduction of body weight if possible, performing pelvic floor muscle exercises and urinary bladder exercises. And additionally, that is extremely important in postmenopausal women is a local application of estrogen gels and creams. If there is no change, then pharmacotherapy is in order. Drugs such as antimuscarinics and beta-3 agonists are widely available and prescribed. And for patients who still have no improvement, other treatment options such as intravesical application of Botox, suburethral slings operations, percutant tibial nerve stimulation, and sacral neuromodulations are available. When we wonder on what aspects of life urinary incontinence affects, with one word we can say to all aspects of life. Professionally, patients have more absence from work and reduced productivity. Personally, they buy special underwear and beddings that are watertight. They wear white clothes and darker colors. Socially, they reduce social interactions, going to cinema, to theater, in the parks with their children and grandchildren, and they make travel plans according to toilet access. Sexually, they avoid sexual intercourses and intimacy because of fear of urinary incontinence. That all leads to psychological impact with guilty and depression episodes, and those people are in the constant fear of losing control of urinary bladder in public and in fear that people around them will know about their problem. So, let's say a few general information about functional magnetic stimulation. This is non-invasive therapy suitable for all types of urinary incontinence. The electromagnetic field causes deep stimulation of muscle structure, repeated contractions of certain pelvic floor muscle, which achieves an effect similar to that in Kegel exercises for pelvic floor muscles. No direct contact to the skin's sensory receptors and C fibers, resulting in pain sensation, makes it more acceptable than conventional electric stimulation. Rapid changes in the intensivity of the magnetic field cause magnetic induction, that is, electric current in neurons. Neuronal depolarization is transmitted to the motor endings of the muscle cells and sacral S2 to S4 roots and causing neuromodulation. Depolarization also occurs in sensory afferent fiber of autonomic nerves that regulate local blood flow and increases the local blood flow to this area of the body. In this slide, we have a few schematic presentations of how functional magnetic stimulation works. In recent months, new publications regarding the effectiveness of functional magnetic stimulation have been published, as you can see on this slide. In University Hospital Santa Rijeka, we use the functional magnetic stimulation for more than 10 years, and for the past 4.5 years we have new 3 Tesla chairs. In Croatia, this therapy is covered by our health insurance for women who are younger than 65 years of age and for elderly of 65 years that are refractory to medical therapy. In this slide, we present our protocol, let's say. The duration of one therapy is 30 minutes. Therapeutic cycle is twice a week. Our ladies come in 2 separate groups, one Monday to Thursday and the other Tuesday and Friday. They come 8 weeks, that is 2 months, in total of 16 therapies. In this schedule, we have more than 500 patients that have been successfully treated on functional magnetic stimulation and who had problems with urinary incontinence. Here is the picture of the setting where we have our chair in our hospital. It is settled in our outpatient clinic, and patients can have therapy from 8 in the morning until 6:30 in the afternoon. And as you can see, it's not some kind of fancy atmosphere, it's a normal outpatient clinic ambulance. We can conclude, to date, no side effects have been reported in the therapeutic application of the electromagnetic field. The effects of magnetic stimulation are an increase in the strength and endurance of the pelvic floor muscles and sphincter muscles. And in the end, I would like to thank you all for your attention with this humorous sketch about urinary incontinence, and hopefully none of us and none of our patients will have any problems with urinary incontinence. I thank you all for your attention and looking forward to any questions of you. Thank you.